Everybody takes care of heart failure patients, whether you're a consultant, a subspecialist, or a general practitioner or family medicine doc. And the general things to know if you're on the front lines taking care of patients as an internal medicine, family medicine doctor is the important role that the patient plays in his or her therapy, which is adherence to the medicines, but also importantly, we teach our patients to weigh themselves daily and to notify somebody, that whatever team's following them, of a sudden increase in weight or symptom change over time, because that could signal that their disease is destabilizing. So for the general practitioner, maybe getting the patient to the cardiologist, getting them on the right medications, but the daily follow-up is often done by primary care docs, especially in more rural areas. What needs to be known by cardiologists or heart failure specialists is more of the advanced therapies we already talked about. Surgeons are more and more our partners in the treatment of advanced heart failure because there are more surgical options. The implantable devices we talked about, the newer, and there are newer generations of left ventricular assist devices. So what surgeons, I think, need to know is in partnership with heart failure specialists, heart failure cardiologists, because we make decisions that involve a team. Sometimes valvular surgery is considered, sometimes, who needs valve repair or replacement versus a ventricular assist device is a kind of a team decision. So the surgeons are very involved in heart failure care. In our practice, we have offices in several cities in Indianapolis or in Indiana, and so we have a referral network where if you live in a smaller town, you would get referred if you wish to come. Europe and Canada depends on not just the country, but also the healthcare delivery system in that. So I can't really speak for Canada or any particular place in Europe. I think that people can be disenfranchised from healthcare for a lot of reasons. One is whether or not they have insurance coverage. Secondly is whether they're referred by their doctors. And thirdly is whether they choose. Sometimes we see patients from smaller towns and smaller communities in our state who don't elect to go towards advanced therapy, thinking that, well, it's just, no, that's not for me. The biggest development in heart failure care over the last, say, 2 decades has actually been the fact that many of the life-saving medications are generic now. So affordable medicines for heart failure patients have been available now for many years. So that's huge. These newer therapies, both the pharmacologic therapies we talked about and the advanced therapies, are quite expensive. And so we depend on both companies for patient support, which the pharmaceutical companies have been very generous. And then with regard to the more advanced therapies, transplant and ventricular assist devices, a lot of that has to do with negotiation on the part of insurance companies, healthcare systems, and individual institutions with the makers, in particular, of ventricular assist devices. It's very expensive, high-ticket item, but in order to deliver this advanced care, the hospital systems have been partnering with companies and getting it done.